We are now going to begin 12-lead ECG interpretation. Ultimately, once you learn all of the steps that we are about to go through, ECG interpretation is performed all at once rather than in a stepwise fashion. However, before you can achieve that result, you must first learn to go through each ECG step by step in a very organized fashion. If you learn to do this in the same way every time, you will never miss an abnormality on a 12-lead. The first thing you should do when looking at a 12-lead ECG is to determine the heart rate. Determining heart rate is an extremely easy thing to do on a 12-lead ECG because of the standardized graph paper that is used to print these recordings. As you recall from the first chapter, the very first thing you need to do anytime you are presented with a 12-lead ECG is to look for the standardized potential at the beginning of each recording. That box is always 200 milliseconds wide. At the normal paper speed of 25 millimeters per second, it will be one large box wide. Additionally, if the gain is set to normal, then the height of the signal will be two large boxes tall, which equals 1 millivolt in amplitude. As long as this standard potential is recorded in this way, then all of the following values will be true. Each small box is 40 milliseconds in time: 40, 80, 120, 160, 200. Each large box is 200 milliseconds wide, or 0.2 seconds. Because of the timing relationships on a standard 12-lead ECG, it is quite easy to get a rough idea of heart rate as long as you remember the following numbers. First, find a QRS which falls on top of one large dark line. Then count over the following sequence of numbers: 300, 150, 100, 75, 60, 50. Whenever you hit the next QRS which falls upon one of these lines, then that is the heart rate. Let's look at a few examples. If the QRS that you find on top of a large dark line begins here, then we count over 300, 150, 100, 75. The next QRS falls on this line, and therefore the heart rate is exactly 75 beats per minute. In the next example, the QRS begins here, 300, 150, 100, 75, 60, 50. It is between 50 and 60 beats per minute. The heart rate here is 55. If the QRS is here, 300, 150, 100, the heart rate is 120 beats per minute. And in the final example, 300, 150, 100, 75, 60, the heart rate is 63 beats per minute. You have to memorize these numbers: 300, 150, 100, 75, 60, 50, and then 43 is the next one if you're interested. Once you have these numbers memorized, a very close approximation of heart rate can be determined with a quick look on any 12-lead ECG that is regular. Let's now turn our attention to some actual ECGs in order to apply what we have learned. First, we should look at the standardization signal at the beginning of the ECG. It is 5 millimeters wide, implying that the speed of the recording paper is normal. Now we find one QRS which is sitting on top of a large dark line, right here. We begin counting to the right: 300, 150, 100, 75, 60. This patient's heart rate is slightly faster than 60 beats per minute, 62 beats per minute. Here is another ECG for us to use to determine heart rate. The standard signal is normal in width. Here is a QRS that's sitting on top of a large dark line: 300, 150, 100, 75. This patient's heart rate is 75 beats per minute. Let's look at the heart rate in this tracing. Here is a QRS on top of a large dark line: 300, 150, 100, 75, 60, 50. This patient's heart rate is slightly lower than 50 beats per minute. The final piece of information that you need to interpret heart rate on a 12-lead ECG are the normal values. Normal heart rates range between 60 and 100 beats per minute. These are values set many years ago based on population studies. Values under 60 beats per minute are considered to be bradycardic or slow, and values greater than 100 beats per minute are considered to be tachycardic or fast. If you need a more accurate determination of heart rate than the simple estimation that has been taught to you so far, the way to do that is also quite simple. It just involves a little bit of math. Since an ECG tracing is measured in milliseconds, we must first try to figure out how many milliseconds there are in a minute. That one's pretty easy. There are 60,000 milliseconds in a minute. If you then count the number of large boxes between any successive RR intervals, and then count 200 milliseconds for each large box, then add 40 milliseconds for each small box. In other words, as we look across the tracing, we would count 200, 400, 440 milliseconds. Divide that into 60,000. 136 beats per minute would be the precise heart rate in that situation. If instead we counted across 200, 400, 600, 800 milliseconds plus two small boxes, 840, 880, and divided 880 milliseconds into 60,000, we get a heart rate of 68 beats per minute. In this way, you can get a more precise determination of heart rate if it is actually needed.